Good morning, everybody.
Morning.
Good morning.
Good morning.
Good morning.
Morning.
So I'm going to go ahead and get us started because we have a very full agenda today. I know people are going to continue to cycle in a little bit. Welcome everyone to the Face Covering and Workplace Outbreak training hosted by the hosted by the Mid-Columbia Economic Resilience Team. I am Jessica Mehta, Executive Director of Mid-Columbia Economic Development District, or MCED, as we say our acronym. We serve Hood River, Wasco, Sherman, Skamania, and Klickitat counties with a variety of economic development services. The Mid-Columbia Economic Resilience Team, who organized this training today, is an effort co-led by myself and Nate Stice with Oregon Governor Kate Brown's Regional Solutions Office, with a group of 50 economic development and workforce partners across the 7-county area of Washington and Oregon to help to respond to the COVID-19 pandemic from a business and employee focus. So many thanks to all of our presenters for being here today, and especially to Nate Stice for really pulling this training together. Thanks also to all of our attendees for taking time today from your very busy days to be here. As I said, we have a lot of valuable information and well-credentialed presenters in store, and we'll be powering through to get you useful information and be respectful of your time. There's perhaps too much to cover, so Nate and myself will do our best to keep our presenters on task. And that's just a heads up also for other presenters. We unfortunately lost some of our Washington-focused presenters, but we will still have some Washington state guidance. And also much of what we're covering today is not state specific. Before we dive in, I want to briefly acknowledge the uncertainty of this moment and all that's being asked of our businesses. Our work to protect our employees and our customers will be vital to keeping the economy moving during what will likely be the long haul until a vaccine is widely available. So this work is also important as we prepare for a probable spike in cases. So thank you again, really, for making the time and the commitment to be here today. Just a few housekeeping items. If you're not presenting, it's helpful to turn off your screen so that the presenters' screens are highlighted in the Zoom meeting. And of course, please keep yourself muted. Use the chat box if questions come up as you're listening to the presenters, or also if you have ideas that you think would be useful to share with the group. We did have over 100 people register for this training today, so the group think is actually really valuable for everyone. We've seen that in other trainings that we've done. So with that, our first portion of today, so today the face coverings is first and then workplace outbreaks is second. We are gonna start just with a quick update from our public health on the number of cases in the various counties and other considerations to think of. So I'm gonna turn it over to Mimi McDonald with North Central Public Health District, and then Trish Elliott with Hood River County Public Health. Mimi?
All right, thank you. Good morning. Good morning, everyone. Thank you so much for being here. This is really, really appreciate you being here. Nate is just pulling up some very few slides, I promise. I wanted to give everyone just a very brief update of what is happening in our region. And then we'll go on a little bit about some of the science behind transmission and why physical distancing and face masks are so important. So if I could have the first slide, great. So in Wasco County right now, we currently have 94 confirmed and presumptive cases. So just to give you a sense of how much things have changed, in March, April, and May, we had a total of 24 cases. In the past 10 days, we've had 32 cases. So just a substantial uptick in the number of cases that are coming in every day. Hood River has a total of 97 cases. They had their most recent uptick has not been quite as substantial. They had more workplace outbreaks, and Trish Elliott will get to that in a moment. Sherman County now has 3 confirmed or presumptive cases. Gillum County, just this past week, got their first case. There's only 1 county in Oregon with 0 cases, and that is Wheeler County. Next slide. Thank you. So this is something that you can see on the OHA website, which for you data nerds out there, I like to check it out. So the things that we're looking at have to do with where the COVID cases are coming from, and do we know where they're coming from? So when we look at this graph, as you go looking at it from the left side of the page to the right side, obviously the numbers are going up. Anyone who's paying any attention to the news has known that. However, what's even more concerning is if you look at the line that's there in black, that shows the 7-day average of number of cases without a known source. So in other words, so these are individuals who are not sure how they contracted COVID-19. There was no workplace outbreak that they know of. They weren't in close contact with a known COVID case. So again, concerning because that indicates to us that there is more community transmission, which is harder to get a handle on and harder to get in touch with people. So next slide, please. Just to give you a sense of the number of outbreaks that are here kind of regionally in Wasco County, we have had 5 workplace outbreaks. There has been only 1 outbreak in a long-term care facility, and that is since resolved. If any of you have a chance and you know anyone who works in a long-term care facility, like or in other words, a retirement home or the veterans home, please tell them a huge thank you. They've done a tremendous job keeping that very most vulnerable population safe. The work that they have done not to get ill themselves and not to transmit it to the people there is just phenomenal. Sherman County has experienced 1 workplace outbreak. And Trish, if you want to jump in, if you don't mind, and maybe you could just say a bit about what's been happening in Hood River County.
Yes, hi. So in Hood River County, we've had multiple workplace outbreaks, some much more substantial than others. And right now we are looking at a couple of outbreaks occurring right now. An outbreak, as Mimi said, well, we'll get into what an outbreak actually is a little further in the presentation, but we fully expected to see an uptick in numbers recently with the holidays and increase in tourism and just more people out and about. So.
Thank you, Trish. Yes, may I have the next slide? So just briefly, I'd like to talk just a little bit about what we know about transmission. As Jessica mentioned, there is still so much uncertainty, even in the scientific community, certainly coming down from other sources. So it can be confusing. Here is what we believe at this point, that the main way that COVID-19 is transmitted is in direct person-to-person transmission from either droplets, those are those larger particles, which we believe kind of fall to the ground. But then there is good evidence that there is airborne transmission as well. So the way I have people think about airborne transmission is if you're in a room or in a house and someone's cooking bacon, yeah, those particles are transmitted via an airborne source. So if you can smell it, it might be there. So just something to think about. Now, droplet transmission is most likely more the cause, but airborne transmission is possible. And in fact, some researchers, believe that's the dominant route for infection. Again, the example I'll give is there was a outbreak very, very early on in Washington state, which happened at a choir practice where one person who was infected with COVID-19 went on to infect more than 40 others with that airborne transmission. Just from the singing seems to be an effective way to transmit this virus. Now, we also know that the virus can be transmitted prior to the development of symptoms. When we do tracing, we go back 48 hours before the person developed any symptoms because we know that transmission occurs during that time. The other thing that we know, we're not sure 100% how long people can transmit the infection during the course of their illness. It does seem to be that there are more viral particles and therefore more transmission in the earlier stages of infection. That's why it is so very important. People must stay home when they're sick. Doesn't matter if they think it's a cold. If you're sick, you need to stay home because you just don't know and you people, we're just stressing this so much, you need to let your employees know. You'd much rather have them stay home for 2 days when they're, and to get things sorted out. Doesn't mean they're necessarily going to be home for the duration, but very, very important. All right, next slide, please. So all of you probably know this, and there's all sorts of guidance about it, but of course, wearing face masks protects people, both healthcare workers and the general public. So not only does wearing those cloth face coverings, can that help prevent you from spreading the disease, it probably prevents you from getting it, cuts your chances by maybe 20%. So not bad, it's better than nothing. So please wear those face coverings. The current policies of at least 1 meter, so about 3 feet, 6 feet, physical distancing are associated with a large reduction in infections. 2 meters might be more effective. So that's why we keep our physical distancing. Of course, hand washing is vital. And again, sick employees need to stay home. Please screen your employees for illness, and then making paid sick time available to employees and making sure that they know that it's available ahead of time is crucial. So I believe that is it for my slides for this morning. So thank you, and we'll keep going.
So Mimi, just to confirm, I think that was also the science of face coverings part that you were talking about.
Yeah, it's all rolled into one.
Okay. I am going to share from the Washington side of the river right now. There's 10 cases in Skamania. They've had a total of 10 in Skamania County and a total of 72 in Clickitat County. I don't have the details of workplace outbreaks that Mimi had. Washington also has a great data dashboard for those data geeks. There it is in the chat box. Mostly we're gonna keep some of the questions to so there'll be a question period at the end of the face masking section, and then a question period at the end of the workplace outbreak section. So I see questions in the chat box, but I'm gonna contain those for those sections of the agenda. The next part of the face covering section, we'd like to invite Nate Stice with Governor Brown's Regional Solutions Office and Michael Wood, Administrator for Oregon OSHA, to share what that face covering guidance and enforcement looks like for Oregon and Washington.
Good morning, everyone. Thank you for joining this training. I'm not going to spend too much time going over the guidance and documents. I'm going to post links to them. I hope that everyone has had a chance to read them, and we'll follow up and make sure that they get in your inbox. I think generally on the Oregon and Washington side, face coverings are required when you're in a public space. That's the top line. In Washington, there's some more specifics around public spaces outdoors. In Oregon, it's really focused on indoors. But I think, as we heard from Dr. McDonald just now, best practice and politeness these days means that we're wearing them whenever we can't keep socially distant. And so that's the broad summary. I do want to draw out some distinctions. In both cases, there's exceptions from both in Oregon and Washington, exceptions around people who don't have to wear masks. And we can talk a little bit about what those are. That's drawn out in the guidance. There's also different ages in Oregon and Washington at which people are required to wear a mask. So as I understand it, and Jessica, you help me out if I'm getting this wrong, it's 5 years and older in Washington and 12 years and older in Oregon. There in the recommendations, it does suggest that kids younger than that, between 2 and 12 in Oregon and 2 and 5 in Washington, still try to have them wear masks. In both cases, business owners do have a responsibility to enforce this mandatory requirement. And I have an expert on Oregon to talk about what that enforcement looks like, Michael Wood from Oregon OSHA. So I'm going to invite him on to talk about this, and I will post the links to the guidance right now for Oregon and Washington that talk a little bit more about what Washington looks like. Michael?
So good morning. Now, I'm not going to keep the mask on the whole time because I like people to be able to see my facial expression, but I do want to illustrate that you can hear me fine. This is a lightweight disposable mask. It's one of the masks that my wife, who has a retail store, provides to her customers if they don't have a mask. I like it because for masks that you want to take on and off, the ear loops are nice. If you're really going to wear it a long stretch, there's something to be said for taking the pressure off your ears. But one of the nice things about that mask is because it's lightweight, it doesn't actually create as much pressure on the ears. The other thing I'll say about it, you know, this isn't scientific. This is my personal research. I have sneezed multiple times with that mask on. If I hold my hand 2 or 3 inches in front of my face, I can't feel the sneeze. So for all the folks who get into the virus is so small it'll pass through, we're talking about catching the droplets, and it certainly reduces that. You know, in my more crass moments, I've suggested to people, well, can you spit through it? And they say, well, I don't spit on people. And I say, actually, you do every time you talk. You just aren't conscious of it. I'm sure the public health folks are thinking, well, that's not terribly precise, but but Mimi at least likes my approach. We've had a lot of questions since the guidance came out and then as it expanded to statewide about employers' responsibilities. And that's why we put out what we view as a clarification of the OHA guidance or interpretation, application, whatever you want to describe it. Our basic posture is you can't require customers to do something or guests in your establishment simply by putting a sign on the wall and then disregarding any violations of that if they come into the store. Our best practice recommendation is that you greet people if you have that capability. You remind them of the requirement. You ask them if they refuse, if they have a medical exemption. If they have a medical exemption, you don't inquire any further about that, but you do discuss ways to accommodate them, either through service outside the store or through putting more restrictions on their activities in the store, greater distancing, just operating in a portion of the store. It really depends on the specifics of what is available to a particular establishment. But we do expect that the requirement be enforced. From our perspective, we almost view the requirement that the public wear masks as being more important to worker protection than the expectation that other workers wear the mask. Because it's, you know, if you think about a grocery store, the people to whom the checker is exposed again and again are a series of individuals in the public. And since the primary value of the facial covering is protecting other individuals, that's the perspective we view it. So the purists from Oregon OSHA and Workplace Safety will never call it PPE or personal protective equipment, because from our perspective, its focus is source control. And, you know, there are all sorts of masks out there. There are all sorts of face coverings, just like with hearing protection. If you've got people who have to wear it for a long time, it's worth trying some different designs rather than trying one, saying I can't breathe through that, and then being done. Just to cap that off a little bit, I will point out that I actually have pretty severe asthma. I can wear either the cloth mask I have or the disposable mask I just showed you for the course of the day. If I were actually in a setting that I needed to wear a facial covering day in and day out, I'd probably wear a face shield instead. Not so much for the breathing, but because I'm not one of those people I can scowl with my eyes. I haven't really mastered smiling with my eyes. And so I prefer to have my face unfettered. There are a lot of options out there. And as you know, the retail establishments seem to have struggled with this. In Oregon, at least, based on the complaint feedback we've gotten, most restaurants and eating establishments that are making an effort to enforce it are actually having pretty high compliance. And so I think really, rather than focusing on the exceptional situation and the extraordinary problem, if we enforce it, we'll get there through largely voluntary compliance. Once people know it's an expectation, they know it's going to be required, they will come in line with that. With regard to our enforcement here in Oregon, we've now had, I think it's about 6,500 COVID-19 complaints since the beginning of March. Our normal enforcement workload for complaints in a year is 2,000. That's meant that we have to respond to those complaints using an approach of contacting the employer, discussing and trying to address the issue, rather than simply initiating an inspection. And in the case of new and changing requirements, that's a good approach. It works. It's appropriate to the situation, so it really makes a virtue out of necessity. The only citations we've issued, and some of them have been pretty hefty penalties, but the only citations we've issued really have been in situations where we haven't been able to resolve it through telephone contact, through back and forth by email. And those hefty penalties were all in the face of employers who simply refused. That wasn't facial coverings then, that was about opening and reopening guidance. But frankly, we've got a facial covering citation that's going to be the same thing related to employees. Nobody's getting surprised by this. Nobody, we aren't, I think there's a fear that we'll get a complaint and then just send a citation in the mail. That doesn't meet our burden of proof. That's simply not how we do business. If you get a complaint from us, the best thing to do is respond. That makes an inspection less likely, and if an inspection does occur, it makes it less onerous. And we're actually giving folks a lot of latitude to find the approach that works in their workplace. I'm sure that there are probably questions, but I know we're waiting until the end of the session to take them.
Thank you, Michael. I just wanted to, and Michael will be around for the question and answer. I just wanted to put one piece out there and ask Jessica if I missed anything around the broad summary of the guidance. The one piece that I do need to say is that there are industry-specific face covering requirements and other face covering requirements for employees that you all should be looking at the individual sector guidance on the OHA website that I posted for Oregon, and I'm assuming there's a good site for Washington for that as well.
And for people in agriculture or with labor housing, it's important to remember that we actually have temporary rules addressing the COVID-19 emergency that are on our site as well.
Yeah, thank you, Michael.
Okay, thank you, Nate, and thanks, Michael. Now that we have a little bit more information about what the guidance is and the enforcement, what that would look like, the question is, what could you actually say, and how can you say it to a customer that doesn't want to wear a mask? So for that, we've invited Shauna Knight with Lewis and Clark Small Business Legal Clinic to join us, and she has a slide. Shauna?
Hi, thank you very much for having me, and thank you to all the small businesses who are attending. I'm a staff attorney with the Small Business Legal Clinic. We serve low-income small businesses, and anyone throughout Oregon is welcome to enroll or come and ask questions. We have a portal for general questions, but we also take clients in. And we do have a rural client for rural program for folks in smaller towns where they can get up to 10 hours of legal help for a $25 administrative fee. So thanks for letting me plug that in for everyone. I've been doing a lot of work on all kinds of different COVID things, and as with everything else, things change quickly and often because we're still learning more about the virus. So this one slide is just some things that can be helpful for what to say. And the first thing that we're really concerned about is making sure that we're not being discriminatory in our enforcement of folks wearing masks. Please keep in mind that not all disabilities are really visible and clear. Someone might have a disability or a medical condition that doesn't allow them to wear a mask, and it's not going to be obvious. So what you can do as a small business is if someone comes up without a mask, you can simply ask them, are you maybe not wearing a mask because of a medical condition or disability? And if they say yes, that's the end of your inquiry. You don't have to, and you're not supposed to ask what kind of disability, because that could actually be discriminatory. And you have a couple of choices. You do not have to let someone into your business space if they aren't wearing a mask because of a disability or medical condition. But you do need to see if you can make some reasonable accommodations. And the reason why I say you don't have to let them in is because this is all about reasonable accommodations and protecting yourself, protecting your employees, protecting your other customers or clients. And having someone come in with a mask can negatively affect your health. and you don't have to put your health at risk or other people's health at risk for an accommodation. So if if that's not an issue, you have a big space, maybe you're outdoors, you can just let them in. However, if you don't and you're worried about folks' health, you can also offer them some accommodations. For example, if you're a restaurant or you're a shop, you can have outdoor shopping or outdoor seating, have folks sit down. A lot of this is a repeat from what we heard from Michael Wood at OSHA. So a lot of this hopefully will be a little bit more familiar. A lot of places are offering curbside pickup or deliveries. And then some stores, for example, retail stores can say things like, oh, well, we have a small space, so unfortunately, because of safety issues, I'm going to offer to shop for you. What are you looking for? I can go in and look for you. So just be aware that for disability purposes, the Equal Employment Opportunity Commission has issued some frequently asked questions about this that really help walk you through what you're allowed to do and what you're not allowed to do. You don't have to risk your health or your life, but we do want to do what we can to be fair. So I actually have a little bit more on my slide too about what happens if someone doesn't have a medical condition. So someone might just come up and maybe they don't have a mask yet, or maybe they forgot it at home. I've heard a lot of jokes that people feel like they're Batman or Spider-Man. They go out into the public and they realize that they forgot their masks. That happens. So if someone comes in, just, remind them, sorry, this is the law, or this is my policy. As was said before, in Oregon, for example, you don't have to have kids under the age of 12 wearing a mask, but maybe your policy is, hey, if the child is over 2 years old, they should be wearing a mask. So you can refer to the law or the policy, ask them to come back. Maybe if you have the ability, you can afford to provide disposable masks. I went to just downtown walking around, and I noticed some businesses had like a little stool with hand sanitizer and free disposable masks for customers who could come in. And then another thing that you should really be aware of for your liability, both to OSHA and possibly to your employees and other customers, is if you get sick, you really shouldn't be serving anyone who comes in without a mask and who doesn't have an exception that you're willing to let them in. So on a practical note, though, the law can say whatever it wants, but I really want to focus in on your safety as well. Many of you maybe saw the news where the state police officer went into a cafe in Salem and they refused to wear a mask, even though the employee said, sorry, sir, you have to wear a mask. He cursed at them, and the employee ended up serving them, but asked them to leave. So you shouldn't serve them, but from a practical standpoint, please do not put your safety at risk. There's a lot of things where there's going to be a power dynamic, especially if you're a person of color, or maybe you're a young kid up against a police officer. Do what you can to be safe. And it's very helpful if you have a security system with video. Also, if you feel like in the next kind of little area I talk about, a lot of people are very concerned about what happens if someone becomes violent or aggressive. Preventatively, you could make it so that folks can only come by appointment, reservations. If someone comes up to the door and they're not wearing a mask and they become very upset, you don't have to let them in. I do recommend taking video and documenting folks like this. This will help with your compliance with OSHA, but it also will help with any further liabilities that you have, especially if someone does some property damage. This will help with your insurance and help with if you have to press any charges against them. One really difficult thing a lot of our small businesses are facing right now is the idea that the state is not going to enforce this mask requirement, but they're putting the onus on the business. And a lot of small businesses feel like this is really unfair. They don't feel like they have a recourse to call for help, but on the other hand, they will be fined if they're in violation. And I know this is especially difficult for our business owners who are persons of color. So one thing you should know is if someone gets violent, get to safety and contact the police. The police might not enforce the mask requirement, but they will enforce trespassing, damage, violence to yourself, your staff, other clients. And remember, you're more valuable than your inventory. Make sure that you're insured and make sure that you're safe first and foremost. And, you know, kind of keep in mind too that you are on private property and you have the right to tell people they can't come in. You know, the no shirt, no shoes, no service is something that we are used to hearing. So I added kind of an example of, you know, tack on masks to that. You might have also have seen various signs that say, you know, be nice or leave, or some variation thereof. You don't have to serve someone who is being rude, who is being unkind, who's being mean, or who's violating the law. And you shouldn't serve them unless, you know, it becomes like a safety issue, like I mentioned before, but make sure that you're documenting things for your protection. And then also in case OSHA comes investigating, you'll be able to show, you know, what you were able to do and how you followed the law, regardless of what, you know, someone else was, how they were behaving. So that's all I have for this slide. I hope I kept it to within my 5 minutes, but I will yield the floor back to the next person.
Thank you, Shauna. Just briefly, we did think that it would be helpful at this point to share best practices around how to prepare your employees for de-escalation, knowing that you will have some of those upset customers, as Shauna noted. Karina Farrar with Naked Winery, would you be willing to just share a little bit about what you're doing to help your employees with de-escalation? Oh, you're muted. Okay, oops, sorry. Okay, I'm not gonna touch the button, you touch it.
Okay, do we have it? Okay, sorry. Yeah, absolutely. Before opening, I mean, we started with talking through scenarios multiple times just to kind of help give them language and words around potential situations. We didn't open until mid-June, so we also, I mean, it was great to have the resources of other businesses that had opened. Fortunately, we haven't had any difficult situations come up so far. The majority of customers, they feel bad if they've left their mask in the car, so we've made sure to have a greeter positioned right at the front door, and we have masks available. And people tend to be, you know, especially when it's kind of stated as help keep us safe, they feel like they're and help us stay open. So we really try to position it that way, so they feel like they're, you know, contributing to us staying open and keeping our employees safe. If it comes to a point where someone doesn't want to, we have told them, you know, the first step is just to really be polite and let them know that it's not an option for us, that it is a state mandate. And so being able to stand behind that does help, because it gives us this, it would be, I think, more challenging if we were just saying that that was our own business practice, but the fact that we can say it is a state mandate, we have to comply with it. And I'm sorry, if you're not willing to follow it, we can't accommodate you at this time. You know, please consider coming back when we don't have to follow these guidelines. We haven't had to get beyond that point. Each of the tasting room, we have 3 tasting rooms in the state. Each tasting room at the greeter station does have a cell phone now. So it's nice to see that idea that, you know, like filming it if something does get escalated, but they also can immediately contact somebody if they need to. So there's a greeter station iPhone that they've got at their disposal. And yeah, I mean, for the most part, it helps to be able, because we are, you know, food or beverage establishment, to let people know that they can take their mask off when they are seated at the table. So they'll put them on, come in, sit down, and we do predominantly seat outside because we have outdoor seating. But when people sit inside or come inside to use the restroom, that's another place where we're noticing that they've sat down for a little bit and then they forget. And almost always just a gentle reminder does the trick. So just being, you know, setting a good example, giving gentle reminders has seemed to work. Yeah, we haven't had too much of an issue with things getting escalated. The thing we are noticing now that it has become a statewide mandate and there's more information about it is that we are definitely seeing an increase in people claiming a medical condition that prohibits them from wearing a mask. We heard a lot more of that over this past weekend in particular. So we're just trying to seat them outside right away and haven't gotten to a point where we don't have outdoor seating to accommodate them, but that would be a situation that, I mean, it was good to know that we don't necessarily have to accommodate them, because it is tricky when somebody cites a disability or medical condition, that's, you know, a challenging situation for the employees to confront. Yeah, I guess that's it.
Thanks, Karina. And thank you also. There's some other good tips being shared in the chat box. So the next part of this, and some of this has already been shared in the chat box, is to think, where do you find masks for your employees, for your customers? And for this one, I'm going to turn it over to Michael Held, our Regional Development Officer with Business Oregon, who's going to cover Oregon and Washington resources. Michael?
Yeah, thank you, Jessica. So I just posted in the chat feature a variety of resources that I will walk everyone through. Both Oregon and Washington have made a online database available for businesses to connect to PPE. This is free to use, so no cost. Basically, what you do is you go to the site. You can detail the type of PPE, whether it's masks or gowns or gloves, the quantity that you might need, and then it links you with PPE suppliers. Both of the databases, just kind of as a small word of caution, since everything is moving quick, some of the companies that are detailed may no longer actually have PPE available. So it will require you to do a little bit of secondary research yourself, where you'll have to call the company that it connects you with to make sure that they still have those supplies, and then you can work out a purchase agreement with them. So just as an FYI, if you do get that kind of feedback from a company that you reach out to through those databases, let me know. I'll put my information in the chat box as well. That way we can then update our database. For those of you who are actually supplying PPE, so I know there's some manufacturing happening, particularly in the Hood River County area. It's also a database where you can detail what kind of PPE you are producing and connect to buyers. So it's a great way of being able to get your products into the marketplace. Should also note that both the Dalles and Hood River Chambers have received shipments of masks. I believe the Dalles Chamber, Lisa Farquharson, just posted that they are distributing up to 100 masks. If you give them a call, they can arrange for you to pick those up. For the Hood River Chamber, they just received their shipment and they're working on a distribution plan today. So they will have more information forthcoming about how you can get some of the masks in Hood River County. I also posted a couple different local companies, the West Coast PPE.com and GoLifeRaft.org. Those are two companies in Hood River that are actually manufacturing PPE. So if you really wanted to make sure that you connected to some local companies who are getting PPE out in the marketplace, there's a couple that you can access in the area. Each one supplies a little bit different of a supply, so you can just go on their website, see what they have made available, and help support a local business. So the other thing that I would say, as you all move forward, please reach out to myself. At the state level, we're really trying to keep our arms wrapped around the PPE needs, and it does evolve. And so by getting information from you all about what your needs are, we can be then better prepared to respond and make sure our databases are updated with supplies that are relevant for your business activities. So I'll put my information in the chat box, and if there's any questions about PPE access, I think I'll be able to answer those in the Q&A. So thank you, Jessica.
Thanks, Michael. And I'll just chime in for if there's Washington folks that I can collect those for the Washington side, and I can put my email in the chat box as well. So we're actually at the Q&A portion for this part. A couple questions that I saw that hadn't already been answered. I'm gonna scroll back up. One from Melanie: do we need to document the person says they have a medical condition? What if someone doesn't realize they have a medical condition and reports that they saw someone in a business not wearing a mask? Is that a question for Mimi or a question for Michael?
It's probably a question for me. So if we aren't going to cite because there was one person in the business at one point without a mask, if we go out and do an inspection, I mean, which is down the road anyway, we'd be looking at a pattern of issues. And so, and frankly, if I go into an establishment and I see 50 people and one of them doesn't have a facial covering on, I'm actually going to assume, just as a customer, that that store is basically requiring people to come in. I will wonder about whether they engaged and talked about optional ways of providing the service. I think what's important is that we not get into the trap of saying, well, they have a medical exemption, so the rules don't apply, and I'm just going to let them in without any further discussion or restriction. You still need to look at modifying their experience in a way that allows them to get service, but that also provides protection. Now, in some cases, that won't be obvious to other people. You may have asked them to double the social distance. You may have asked them to only shop and they only needed 2 or 3 things, and you ask them to go directly there and not. We may get the complaint. If we get the complaint, we'll reach out and ask you what you're doing, but we're really looking at practices more than at a one-off situation. The facial coverings aren't like the approach distance with high voltage lines. It's not like one violation of the facial covering is going to cause an imminent danger of a fatality, and so we don't enforce them that way. I apologize for rambling, but hopefully I got there.
Thanks, Michael. Rob Torrey had a question about what about if we have employees that claim a medical exemption? Are there, and again, I'm not sure, is that a Michael question?
Well, if we haven't, it may actually be the attorney's question, but I'll just, as an employer, I'll just say you have a lot more ability to inquire with regard to your employees and to seek indications of the exact nature of the disability as part of the obligation to, so actually it's easier if it's an employee from my perspective.
Shauna?
I would say if you have an employee, maybe making it really clear to all of your employees that if they have concerns, whether it's safety, whether it's the mask policy, to have them reach out to you privately, so that way you can protect their privacy. And then if they have a disability, if they have a medical condition, working with them to accommodate that. So again, that doesn't mean that you have to put anyone else's life or health at risk, because that's not a reasonable accommodation. Other accommodations you might work with are, whether or not they can be in a space that's further away from folks, maybe in an office with a window, whether or not they can reasonably telecommute and still do the work. Some places that's not possible. So also looking at hours, like we're really, and the Equal Employment Opportunity Commission is really encouraging people to look at the work week and think differently about it. Can this person come in at different hours when less people are there? Like looking at your scheduling as well. So if someone has a medical condition, I think I would just maybe assume that anyone might, because again, it's not like all disabilities or medical conditions are visible. And I would just put it out to all your employees. Reach out to me privately so we can protect your confidentiality, and let's talk about possible accommodations and solutions.
Sean, can you ask an employee for a doctor's note?
So legally you can. Practically, especially as COVID cases spike, some people are not, but some doctors are not going to have the time to write a doctor's note for something like coronavirus. So I would, as a practical matter, I would dissuade businesses from going that route because it might not be possible to enforce. Now, in terms of documenting disabilities, yes, you can work with human resources, or if it's a really small business that doesn't have a human resources department, you can work with a person in charge of, employee issues to get anything properly documented. I won't go into all the details of that, but if you do need help with that, I would recommend that you, consult with your small business advisor or an attorney or someone like that to help you get that documentation in place. And that would be my recommendation.
Thank you, Sean. Michael?
Donna, you can ask an employee to describe the disability, though, so that if you have somebody who says, well, sure, I have a disability. I've seen on the internet that these things cut off all your oxygen and you pass out. I don't want that to happen. With a customer, you won't be able to have the iterative conversation that says, yeah, no, that's not real. But with an employee, you can, right?
With an employee, you can have that discussion. And again, that might be something where maybe you invite all of your employees to the table to talk about what they're concerned about, what they're scared about. Some people are, very scared to return to work. So going through all of your safety procedures with everyone, but then, taking that conversation offline with, if you have a documented disability, let's talk about how we get that properly documented, and then, make sure that I would put it out there so that this conversation doesn't come up in front of everyone else. Put it out there so that people do that privately. But yeah, you can do documentation with an employee that you would not do with like a customer coming in or a client coming in.
Okay. Thank you. We are out of time really for this. There's one additional question I see in the chat box. If somebody has an answer to that, I'm going to encourage you to type it in there about do you have to pay to get that doctor's note to cover that for your Oregon employees? And I also just wanted to say, if there are additional training topics along the face covering, de-escalation, or later in the workplace outbreak that you would like to see, then please also put those in the chat box, because we are looking for other opportunities to support you. So with that, I'm going to turn it over to Nate Stice with Governor Brown's Regional Solutions Office to facilitate the workplace outbreak section of today.
Thanks, Jessica, and thanks everyone for sticking with us with a pretty ambitious agenda. I think we had initially thought about just doing the workplace outbreak standalone, but the face covering seemed really timely and wanted to make sure we got it in there. The workplace outbreak is really, we'll talk a bit about prevention, but we're really going to talk about what happens when one of your employees gets sick or multiple of your employees get sick, because this is happening throughout the state, throughout the country, and really wanted to get you sort of familiar with what that looks like from a business perspective, engaging with public health. And hey, Michael Held, before I forget, I know we might have some folks on here from different areas. Would you mind throwing up the Business Oregon Regional Development Officer contact and maybe the Regional Solutions page for folks so they can get in touch with their local point of contact? And I'm saying that because really the primary point of contact for folks, if you're outside of the 7-county region, is going to be your local public health, is sort of our first line of defense. And these are local public health folks. I've had the privilege of working with them over the last few months. They are some of the hardest working people, and I'm just so grateful for Director Trish Elliott of Hood River Public Health and Dr. Mimi McDonald of North Central Public Health making time to join this webinar. And we're going to talk with them about a little bit what engagement with public health looks like around an outbreak. and then we'll move into hearing from a business that experienced an outbreak. We'll talk a little bit about caring for your employees, and then we'll do some more question and answers around this. So with that, Trish and Dr. McDonald, are you, Director Elliott, Dr. McDonald?
Yes.
I guess the first thing is, and I think Dr. McDonald already talked about this a little bit, what constitutes an outbreak?
Okay. So I will just let you know that we consider.
Papers in front of the camera.
Can you hear me?
Yeah.
Okay. What we consider an outbreak is defined by the Oregon Health Authority. And so for local public health, an outbreak is 2 or more cases in most work settings. However, for child care facilities, long-term care facilities, and food processing facilities, the threshold is 1 case. So 1 confirmed case or even 1 presumed case of COVID is considered an outbreak. This does not mean that you're automatically going to be shut down. And just so you know, I did post a link to the Oregon Health Authority's page, reports page on COVID-19, because they do publish once a week information about workplace outbreaks that involve 5 or more individuals. And that, like I said, that is updated once a week. So
maybe Dr. McDonald, how does one learn about an outbreak?
So for a business owner, what usually happens is the employee the best way that it happens is an employee contacts you first. That's what we certainly encourage employees to do. If, however, that employee has not, in certain business settings, so for example, any congregate workplace setting, even 1 person testing positive, then actually your local public health authority will reach out to you. So again, normal chain of events, the employees talk to you, and that's what we want you to talk with your employees and encourage them to do that when they get positive tests. That's the way that it should work. We don't like to jump over people's rights to privacy. However, sometimes we do talk with the employer directly. So employers are not going to receive lab tests or anything, but you may get a call from local public health to talk about if the fact that indeed there is 1 or more employees who has tested positive at your workplace.
And so the next piece is that hopefully your employee will tell you if they have a positive test, or if you see them with any symptoms, you have a conversation with them. So what's your responsibility if an employee comes to you and says, I've been tested positive? We actually had this question come up before this event. Director Elliott, do you want to chime in on this one? You just put yourself on mute.
So
you're good.
Okay. So so the employer's responsibility, we actually do encourage the employer to notify their other employees that without identifying anybody that there has been a case, and that public health will be contacting anybody who is considered a close contact to that case. And at that point, when we do our initial investigation of a positive case, we are identifying people that employee has had close contact with, both at home and at work. And we elicit quite specifically and define what a close contact is for that person. So the employer may actually experience loss of more than 1 employee. If somebody tests positive, they may also be losing a couple of employees for as a close contact for a minimum of 14 days.
So it's safe to say that if for some reason you hear first from your employee that your first call should be county public health.
Yes.
And as I understand it, Dr. McDonald from the email exchange this morning, that you have to do that. Is that a requirement? If someone comes in and says I have a positive test, is there a requirement to reach out to public health on that front, or is it just the right thing to do?
So there is actually a requirement for employers, and I'm sorry because I'm not 100% sure if it is 2 or more, or even if there's 1, to reach out to local public health. As I put in my email, usually we know, but we don't always. And so it's definitely better to be on the side of reaching out to your local public health department because one, again, so we can help you and then we can sort out going through the next step that happened. But 2, sometimes not because they're being duplicitous, but sometimes we've actually had it happen that employees are not always 100% sure which, for example, which orchard they're working in. So we really need it to be a partnership between the organizations and local public health.
Mm-hmm.
We're gonna talk a little bit later about resources for employees, but to this point around, we're talking about people's incomes, we're talking about your livelihoods, and we're talking about people's income and their livelihoods, and really making sure that everyone knows that there are benefits available and what's available to them will help keep you and your employees safe by encouraging honest and open communication, right? And those are probably some hard conversations to have. I know in normal operating circumstances, it's hard to keep me away from the office when I have a little cough. So that's just we're going to talk about some pieces and establishing that open and honest communication with folks. So, okay. So we have 2 or more, we have 5 or more that'll get you on the OHA list. Trish, you started talking, Director Elliott, you started talking about testing and contact tracing a little bit. And I think people are probably broadly aware of what this is and what that means because we've all been reading about it. But I guess the particular question here is what does that engagement with a place of business look like? What does when you go into a company and you're investigating a case that's related to that company, are there particular ways in which you do testing? What information would you be asking for of the business? If anything around that looks unique in an employment setting, and Dr. McDonald.
Well, certainly we are looking at environmental controls in the workplace. What is their work setting looking like? Are there employees using masking? Are they following what we call the 4 pillars? Wearing a mask, washing their hands, distancing, and staying home when they're sick. Those are the 4 things that really need to happen to prevent outbreaks. We're talking about, are employees gathering in the lunchroom all at one time, or are they altering their lunch schedules so that there are fewer people accessing those areas at one time? Who is on each shift? If they're doing manufacturing, who works next to each other and how far apart? And some things that some employers don't think about is, are your employees commuting together? So are they on the same, riding in the same vehicles to and from work, large numbers of employees? It's those kind of things we are asking when we're talking with employees who have tested positive. And then in speaking with the human resource person or the manager or whomever in the workplace, we're also asking those questions. Sometimes employees don't know the full name of people they work with. They may not know their last name. So sometimes the employer is helping us contact people who may have been exposed in that way. We spend a lot of time providing guidance and giving support to employers and employees through contact tracing and our daily chats with our cases. And then on the other end of it, we are providing guidance for return to work and when it's safe for those employees to go back into the workplace.
So what I'm hearing is there's a lot of post-outbreak consultation that happens to really think about safety practices around the employee. And I will just say that I know in some instances, both the Department of Agriculture and Oregon OSHA have a role to play in sort of doing these, and I know that they provide consultative services. But maybe Dr. McDonald, you can help me understand. So you call public health, they show up with a bunch of swabs.
No.
or so what does testing look like in this case? Do they show up and you ask for, go ahead, Dr. McDonald.
All right, thank you. So it's definitely individualized to a workplace. So what I will say, for example, you have an employee who tests positive or two and you contact local public health. As Director Elliott mentioned, the first thing that we will do is we will ask you to look at your records, try and determine who are people who've come in close contact, so that's within 6 feet for 15 minutes or more, from 48 hours before that person had symptoms up until their last day of work. So it may be a list of 1 worker, it may be 2, 5, or 10. It's difficult to know. Currently, in terms of what we are doing, we're working very hard, especially in congregate workplaces, that we will very quickly move in and test those close contacts. OHA is kind of the way that we're dealing with this has shifted a little bit, and we are doing maybe a little bit more targeted testing. So let's say, and this is aside from long-term care facilities, which are kind of a separate thing. But for example, let's say you have 30 employees and in a manufacturing place, really only 5 people are on the line. Well, we would go and test those 5 people who are next to the person who is the contact. And the ways that that would happen could be different. They may be tested at one of our local clinics, depending on how that's working out. Certainly some folks have gone through One Community Health or Mid-Columbia Medical Center. At times, public health will actually go out to a facility. I've made a couple of trips, some field trips, because sometimes that's just more efficient and we can do it in a more rapid way and it's easier. Certainly people have to travel long distances. And so then we can do outbreak testing. Yep, it's Q-tip up the nose, well, both sides. So it's not too bad, but then we can really keep track of what's happening. And then of course, there are all the interventions that Director Elliott was talking about that happen ongoing, that happen later. But we really are working hard on getting right in there when the first couple of cases show up.
Right. And this is Trish again. I would just like to point out that in Hood River, we actually don't have Dr. McDonald here to go do testing for us. So we generally refer to One Community Health has done a lot of testing for us. Occupational Medicine through Providence has done a lot of testing for us. Columbia Gorge Family Medicine has done testing for us, and Providence Hospital, as well as MCMC, has done testing. So we spend a lot of time coordinating testing opportunities for employees when that is the recommendation.
And Nate, if I can just add one thing, and this is to all of the employers and business owners. There is no shame in having an employee who tests positive for COVID. That is not a mark against your workplace. And so I think that one of the most important things to do is, as Shannon mentioned there, is that it is incredibly important to be as open as possible with all of your employees, even if you're not required to notify all employees. Number one, they will find out. People will most likely figure out who it is, and even if they don't, there will be lots of rumors. It is so much better to get ahead of this and to, in terms of employees, and certainly many businesses have done press releases. Again, this is not a shame thing. This is just the reality, and I think that your workers, people who come to your business and the public in general will have much more trust in a business that says, yes, we've had, you don't have to be specific at all. We live in a small community, but there have been 1 or more persons who tested positive in our facility. These are the steps we're taking and moving forward like that. So much better than trying to, not be completely transparent about what's going on. And I just think in terms of how you're, and again, of course, your employees, you certainly owe it to your employees, but also it's just a good, it's a good practice.
Yeah, I fully agree. Thank you, Mimi. And I know that Kathy Mishimoto from Duckwall is going to be speaking pretty soon. And it is, and she can probably address this too, because, you know, things get out there, social media is out there, and social media is not always kind. But we realize, you know, we're in the middle of a pandemic. And people are going to test positive, and we fully expect to see more cases. And it is nobody's fault, and it's just how it happens.
Thank you both for that, and it's really just want to underline the comment, just honest and open communication. And I would just point that it's in your best interest too, right? Because then you know how to handle this. You have a plan. You have the lines of communication. I know you all do this, but you know it will help keep you and your business operating more smoothly and probably limit disruptions. It was all about mitigating closure times and other items that might come out of this. So I guess I've got two more questions, and we're really running up on time. I need to move along. But we talked about contact tracing, and I just want to summarize. I think it's really helpful if you can, if places of employers can help in making the connections of who's connected with who, and helping to actually communicate with employees when possible. And again, the transparency with the public health officials is very important. One piece we already talked about, I'm just running down my question list. Trish mentioned that there's really no requirement to be closed. I think in some cases businesses do close, and I guess we sort of talked about thinking about the health and safety piece and some services that are available there. One thing, so I've got two more questions. The first question is, what are high level the ways that businesses can help you all as public health officials when you come in during an outbreak? Just high level, what information, what other pieces do you need to
Well, I think definitely just helping us determine who was working when, you know, who was working in what department next to whom, that would be helpful, because we're looking at specific dates and people can't always remember, you know, back, you know, oh, 5 days ago I did this, or 6 days ago I did that, but just helping us sort out who was working during a period of communicability, that would be a big help. Mimi, do you have any other?
I do. Please know your employees' contact information and be able to provide that to us. Huge help. You'd be surprised how difficult it is to make sure employees, in this time, please be sure that your employees' contact information is updated, because we do spend a lot of time trying to track people down, and the more that you're able to help us, the better it is. I know that's not an easy thing to ask, but I'm, you know, just for this. And then keeping track, I know, I will say one of the packing houses that have all done such tremendous work, but have done a great job really being clear about, as Chris mentioned, which employees are working on which shifts and where they are in their position. Now, of course, in small businesses, it's not the same thing, but in large businesses, that's crucial. And you should also know your employees' date of birth, because those are things that will help us if we have to do testing and to be able to identify people and where they live. It matters from a public health standpoint. It actually matters to us which county people live in, because that kind of depends on where cases will get recorded. So really having updated individual information on all of your employees is a tremendous asset to us.
And states of residence as well, because we do run into that in this region also.
So this is a 1-minute question. What cleaning is required after you have an outbreak? 1 minute. You can do that in 1 minute.
It's actually not that much. That's the good news. So if possible, if you know that someone was ill in a small room in an enclosed space, yes, you would want to shut that down for 24 hours because if there are any aerosolized particles. If it's if that person is long gone and you don't find out till later, if it's more than 24 hours, there's no point in closing anything down. However, just doing the a deep cleaning, but that just means using a solution that is antiviral. So even the the 10% bleach solution will work, cleaning down all the hard surfaces. Again, what we're really thinking of is that you don't need ServPro to come in. Sorry if anyone here works for ServPro, but you don't need that. You just need to clean all the surfaces, and if possible, if making sure that there's good air circulation, things like that.
Awesome. Okay,
that was another minute.
Just again, we posted the contact links for Michael Held's colleagues and my colleagues, and that have the counties that they serve, and they can help get you in touch with local public health. Dr. McDonald, Director Elliott, thank you. There is one question in the chat box, if you wouldn't mind trying to answer that, if you can answer that, or if folks from the Lewis and Clark Legal Clinic can help. For the next part, I really want to thank, before I hand it over to Michael Held to facilitate this conversation, I really want to thank Kathy Mishimoto from Duckwall for being here and having the courage to share part of the story. I've been just really have had the opportunity to sit on a few work groups with Kathy around farm workers, and I'm just really grateful for the care that she shows towards her employees. So Michael.
Yeah, thanks, Nate, and Dr. McDonald and Dr. Elliott. I appreciate your all's perspective and helping businesses navigate these challenging questions. So, yeah, we'd like to introduce everyone to Kathy Mishimoto. She's the Vice President and COO of Duckwall Fruit, located in Hood River. Many of you may recall back in, I believe it was late May, Duckwall found itself in the very situation, we were just listening about from Trish and Mimi having to manage through a workplace outbreak. And so to help us understand all the work that has to be done to prepare and respond to an outbreak, Kathy has graciously volunteered herself and her story to help us mitigate other potential outbreaks. And so to just pile on Nate's thank yous, I think on behalf of everyone from the Regional Recovery Resiliency Team, thank you for putting yourself out there. I know the impact on you and the employees at Duckwall has not been easy. It's been pretty intense, and some of those wounds still might be fresh. So thanks for helping us walk through your journey. And so we're not going to do this as a Q&A. So Kathy's just going to kind of walk us through her journey, and I may ask a couple just follow-up questions, Kathy, but we'll turn it over to you. Thank you.
Okay, so can you hear me? Because I'm in the packing house and I get vibrations from below, so I moved different offices to see if I could find the most quiet one, so hopefully I did.
You're good to go.
Okay, great. So I'm going to read from my script so I don't veer off, because I often get passionate and go off topic, so I don't want to do that. So we started planning our COVID response plan back in early February. This included talking to our employees. That is probably one of the most important things to do. We talked to Oregon Department of Ag, Oregon OSHA consultation, and our safe loss control consultant weekly at the start of this, and then daily for a few weeks after our outbreak started. I want to say we had a great team of folks helping us prepare. And I'll tell you that if we hadn't have done that prior to May 26th, I'm not sure our response and quick action would have been so smooth. On February 26th, we started a COVID-19, we call it COVID-19 crisis management team, which consists of all departments, from office to shipping to every department in between. And we've met every workday since then, since February 26th. And our president made our attendance mandatory, whether we're in person or dial in, there's no exceptions. We continue to critique and develop our policies and procedures during these meetings. And I'll tell you that this really helped when we got the call on May 26th at 6:02 a.m. I'll never forget that. from an employee who reported to us that they had tested positive for COVID-19. And I would say because of our plans, by 8:45 a.m., we had met with ODA, Oregon OSHA consultation, and the Hood River County Health Department. It's really critical to plan and go through what-if scenarios. That's the key. That'll save you a lot of time and stress if you should be on the recipient end of a phone call that you don't want coming, but I know it's probably going to come. To name just a few policies we put together, I have a whole list of them, but I'll just name a few. We have a COVID-19 action plan, workplace guidelines, positive COVID response plan, cleaning and sanitation response plan, contact communication, back to work guidelines, and Family First Response Act policy. Few of the things that we implemented early on, we appointed I was the point COVID cop. We appointed all the managers, supervisors, and leads as COVID monitors because I can't be everywhere. We went to a closed campus. We locked all entry doors except one on each side of the plant where employees are required to enter. Made all doors hands-free, stopped business travel, successfully negotiated with Teamsters to have 2 separate crews on our day shift and swing shift. So we had 1 week on, 1 week off, which is key when I get to our outbreak. We put up barriers between employees where possible. We started interviewing employees who called in sick or left work sick, asking specific COVID-19 illness symptoms. We handed out cloth face coverings, and it wasn't mandatory at that time. We taped off lunchroom seating areas. We asked volunteers, employee volunteers, to eat in their cars. We removed chairs in the lunchroom to force social distancing. Shut down the vending machines, and the most unpopular thing I did was stopped providing coffee to the employees. We added a teller drawer in shipping to take the face-to-face contact away from our employees when truck drivers are checking in to pick up their orders. We made truck drivers stay in their trucks after they checked in until they got loaded. They had to stay in their truck. Brought in porta potties, hand wash stations. We really wanted to keep our inside facilities for our employees only. We placed social distancing messages on the floors, had daily and then weekly staff updates explaining how to keep safe here and at home. Asked employees for help, and this is really key. Ask them for help in identifying areas of concern, because you may walk through and see something is perfectly fine, but they see something that they deal with every day, and they have concerns over that. We handed out flyers from CDC, OHA, Oregon OSHA, so this was back when toilet paper, paper towels, and hand sanitizers and bleach wasn't available in any store. So we were able to purchase pallets of toilet paper and paper towels and hand sanitizer and bleach to be able to hand out to our employees who weren't able to find some for their home. So we get the call. We instituted our positive plan. And at that time, there wasn't really a whole lot of information on what we should do. So we had planned to shut down and clean and sanitize our entire area. And back then, seems so long ago, but it really wasn't. But back then, it was thought that if you had your own employees do the cleaning and sanitizing, which we do every night because of food safety, but if you had your own employees do the cleaning and sanitizing, at that time, they would have had to suit up. And I don't know if you've been in a packing house, but that's really hard to do, to get underneath the machinery. So we had a contract with an outside firm, and they came in and sanitized the whole plant from start to finish, from one end to the other.
Hey, Kathy, this is Mike. I just wanted to interrupt you for a quick second. We just a time check. We have just if you could speed through in a few minutes so we can hear from our workforce folks. But sorry for jumping in.
No worries. That it's I could go on forever for this. So I want to say is that you need to develop your relationships with Oregon OSHA consultation if you're with ODA, and your local health department. I wish I would have done that. I have relationship with OSHA and OHA and ODA, but I didn't ever have a relationship with the county health director. And without her help, I don't think we would have weathered the storm. I know personally, emotionally, I wouldn't have. So reach out to those folks. Social media is horrible. We went through some really tough times. I would never have thought our employees would have experienced what I call discrimination just because they are an employee at Duckwall. The community knew we had an outbreak after it was announced publicly. I wasn't prepared for the negativity. And so we really had to talk to our employees to help them navigate the ugly path of being treated differently. The last thing I want to say is really watch for depression and anxiety in your employees. I don't speak Spanish, but I have 3 folks that made contact with every employee that was either a close contact or positive, making sure they were okay, their family members were okay, offered mental health assistance. We don't have an EAP, but we do fund visits to mental health providers of the employee's choice and their immediate family for help. That's really key. The employees, this is really tough for them to go through, and you need to help them out. Sometimes they don't know where they can go for help. But I am willing to share my policies, their plans, or anything you want. Just you know how to get a hold of me. Thank you.
Thank you so much, Kathy, and thank you for caring for your employees. And sorry that we're so short on time. So.
No worries.
Yeah, and we do want to get to the last part though, and we've invited a few folks on from Oregon and Washington WorkSource to talk about unemployment benefits, but I think I'd actually like to start with Maria Castro with the Oregon Health Authority, who can broadly talk about sort of employee services and rights during this. So Maria, maybe if we could start with the paid sick leave and maybe touch briefly on UI, and the UI folks can throw their contact information up in the chat since we're so short on time.
Sure, because I know we are short of time, I prepare a little thing that I'm gonna post on the chat. Well, first of all, Maria Castro, I am a Hood River resident, but I work for the Oregon Health Authority. I am assigned to talk to you about unemployment benefits, but I work for the Oregon Health Authority, so I am not really a professional in this area. However, I have to say you become professional on this because the Oregon Health Authority, throughout the outbreaks and throughout the pandemic experience, as Trish and Dr. McDonough had shared before, has discovered that you cannot deal with an outbreak, you cannot deal with the pandemic without having to ensure that the workers and the people are taken care of. And understanding about sick leave, understanding about access to resources such as food, rental relief, worker relief funds, they become very critical. So the Oregon Health Authority has been putting effort on and developing toolkits. And the Department of Human Services developed a very nice webpage that you can access and you can have your employees access, and they will walk you through all the resources that you may need, pandemic EBT, access to TANF, access to food stamps, etc. I'm gonna put the link on the website, and there is also The Oregon Housing and Community Services has a wealth of information around rental relief that I will also add in the link. I know food and food access are incredibly important for Hood River. I've been checking my email because the Oregon Health Authority and the Recovery and Response and Recovery Unit have developed now a resource for employers and employees where it's one-stop shop for resources around food access. I was hoping to have it by the time I was to speak here, but they haven't sent it to me. I will share it with Nate and with Trish and with others. And going to the initial question. So yes, the Oregon Employment Department and BOLI are both very, very well aware of all the questions employers and employees have about sick leave and unemployment resources. One thing that we want to make sure that are very clear is the following. There is the Families First Coronavirus Response Act, or AFFCRA, that more specifically talks about extended paid sick leave. So all employees can get 2 weeks up to 80 hours of paid sick leave at the employee's regular rate of pay, where the employee is unable to work because the employee is quarantined and or experiencing COVID-19 symptoms and seeking a medical diagnosis. Or they can also take 2 weeks up to 80 hours of paid sick leave at 2/3 the employee regular rate of pay because the employee is unable to work because of a bona fide need to care for an individual subject to quarantine. And that would be a person that, because you're a caregiver for that person, or you have to care for a child under 18 years of age whose school or childcare provider is closed because of COVID-19, or the employee is experiencing a substantially similar condition specified by the Secretary of Health and Human Services. In both cases, in BOLI website and the Oregon Employment Department, you will find information about who qualifies, what is it that you need to do, what is the information you need to provide. I have to echo Trish and Mimi's call to ensure that you have the information about your employees. It's very critical that you know their names, date of birth, because that is the only way that we are going to be able to assist them. So again, the Oregon Health Authority understand that wraparound services are critical for employers. Employers need to be aware, but we're also ensuring that when we are developing community engagement resources, we are actually tackling the wraparound resources, and we are making sure that when your employees get diagnosed with a COVID and when they receive the phone call from the county health department and they receive the contact tracing calls, contact tracers are going to be very well equipped with information and be able to do warm handoffs to your employees to make sure that they actually receive the assistance they need. So again, everybody's eligible for sick leave. If you have employees that might not be eligible for many reasons, the state of Oregon legislature gave $10 million and I think $20 million total for something that's called Worker Relief Fund. I'm going to put a link to it as well. And for those of you who actually have agricultural workers, farm workers, we are also developing something that is called the Quarantine Fund that is only for farm workers, and that will ensure that farm workers can actually do quarantine without concern about not being able to work and receive, and affect their finances even further. Nate?
Thank you, and sorry for the lack of time. Mike Scroggs just popped on with WorkSource, and just one quick question, Mike, for you. As I understand it, there is eligibility for unemployment benefits.
That is correct, Nate. After the sick leave or other payroll options are exhausted or unavailable, folks could apply for unemployment insurance. And Eric Profit is on the call from the Oregon Employment Department too, if he wants to add a couple words. One thing, Eric, I had noticed in one of the printed materials was a focus on PUA, and I think it might be helpful just to clarify for folks that most traditional workers are not going to be wanting to file PUA, and not wanting them to get confused thinking that's the latest and greatest COVID-related program.
Eric, we can't hear you.
I think you're muted, Eric.
Still can't hear you, Eric. Sorry. It's okay. So, but basically, Mike, the message though is that you should really talk to the employment department before you think about filing. Is that the distinction?
Yeah, folks should try to file their claims online. Getting through to the phone lines is getting easier, but they should definitely file their initial claim online. Are you there, Eric?
Yes, I'm here now.
Okay.
Can you hear me now?
Yep.
Yeah.
PUA is covering a whole lot of folks through a federal program. It is directed a lot for self-employed, but for folks who have not qualified for a regular employment, they've been determined ineligible because lack of earnings, etc. Once they have been determined they're no longer valid, then we are asking them to file a PUA. It has different requirements out there. Unemployment rate is still about 14%. We have already put $2.5 billion back into the economy through unemployment, which is amazing. There's some great how-to videos on our website. The most important piece, I would say, for unemployment insurance is going online, filling out that application, and making sure it's complete. If you have missing information, it will hold up your claim dramatically. Weeks, months. Yep. We've made a big push with the Focus 100 to get most of the regular claims processed unless they have significant issues. We are now, as an agency, shifting gears and focusing on PUA. It's a statewide effort that's happening. Everyone's all hands on deck working on. Our local offices are closed to the public. We're not able to provide assistance because we're really trying to get these PUA applications done. We do have directions for other alternative offices who can help with general if you need more workers.
Yeah, and the phone number for Oregon is posted. I'm wondering if the Washington folks are on and can just post their contact information for unemployment in Washington. I think the big message here is that there are a lot of services and people thinking about wraparound services for employees if they do get sick, or if they don't get sick, right? And I hope you all are providing this. I know the economic resilience team, one of the topics of future training we hope to have is just a deep dive in each one of these areas, because we know that you're some of the best folks to communicate with employees, whether there's, employment dislocation based on the pandemic or if they get sick. And so we are going to follow up with a full training on these items. We're feeling a little bit crunched on time here. Jessica, if folks can stay on, do we have time for like 3 questions on this?
Sure. I've only seen, there was only one. Oh, I think actually the one question I had seen has already been answered. So I guess we could say if there are a few to type in the chat box. Otherwise, I think we've answered all the ones I've seen. Thank you for the Washington links.
So there's been a lot of resources shared throughout this, and we'll package those all together and try to communicate them out with the video of this as well. I'm going to turn it back over to you, Jessica.
Okay. Well, thank you again to all of our presenters. Thank you to all of our attendees for carving some time out of your day today. As we will, if you registered, I believe that we would have your email. We could send you the video, and we can also, as Nate said, package together information in the resources in the chat box. So with that, I think we're done today. And please do reach out if there are other trainings that would be helpful for you and your your business. So thank you very much.